Hello, Colin Hung here for Healthcare IT Today, and I am at the Oracle Health Summit here in Nashville, Tennessee. To say this has been an eventful summit would be a complete understatement. Seema Verma kicked off the event with a bold keynote. She highlighted all the investments being made by Oracle to improve the Oracle Health platform and to energize the Oracle Health team. Let's be honest, these past few years for Cerner Oracle have been kind of tough. But those days seem to be behind them. There was definitely some steel behind Seema's demeanor and her words. She even poked a little bit of fun at their Wisconsin-based rival. Now, there were two big announcements here at the event. First, Oracle announced their intent to become a QHIN, joining other organizations like eHealth Exchange, Kanza, MedAllies, Health Gorilla, Node2, Commonwealth, and yes, Epic. Even bigger news was the unveiling of Oracle Health's next generation EHR. It is built from the ground up to be cloud native on Oracle's military-grade cloud infrastructure. It also completely moves away from the legacy Cerner interface and offers end users something completely new in terms of a UI. While we were here, the company gave us a preview and a live demonstration of this next generation EHR. I have to say, while the interface has completely been modernized and the number of clicks has been drastically reduced, the most prominent feature of the new system is the Ask Oracle bar at the top of every screen. This ever-present bar is how users will interact with the system. They can speak to the bar and use voice commands to move around in the application. They can also type plain English questions into it, like, what are Mr. Smith's latest lab results? Or, is Mrs. West up to date on her screenings? Or, does Dorothy qualify for hurricane physical therapy programming? And will her insurance cover it? What makes this possible is the embedded Oracle AI capability. And that capability can automate documentation, ordering, coding, answer questions about medications, insurance coverage, lifestyle choices, and community programming available to patients. That's all possible because it consolidates behind the scenes all the information inside the EHR as well as other data sources. Now, the company revamped the interface while preserving the data structures underneath. So this should ease the transition for customers moving from the current Oracle Health system to this new next-gen EHR. While I was here, I met with Kristen Miles. She is the Vice President of Application Strategy at Oracle. She shared some news about the new talent marketplace. Here's a little snippet of our conversation.
Healthcare providers are using third-party staffing agencies, and with the talent marketplace, we're now able to send those requests out to third parties. Historically, it's been a phone call to a staffing agency, very manual, really time-consuming and expensive. And in this case, you can send that to multiple agencies. We've just announced a partnership with Medley, who is a staffing agency, or you can use the one that you've been historically comfortable using. So really exciting way to quickly get talent in. In addition to that, we have the ability to now upskill, enroll. Okay. So if you are a brand new to practice nurse and you want to move up and continue that growth within the organization, identifying those skills that you need, and then offering those trainings within our applications.
I also met with Lisa Gulker, Vice President of Product Management here at Oracle Health. We had a very interesting discussion about real-time health systems. Here is a part of that conversation.
Yeah, it's interesting. It is an industry term, and it grew up as really IoT, the Internet of Things. So it grew up as medical device connectivity. We have an amazing platform at Oracle Health that does that. When I was, again, a critical care nurse, still am a critical care nurse, that was so important to me that the devices were a representation of my patient, and I could access that data in real time, not have to transcribe it, so data latency, data inaccuracies went away. But when you have that mindset and you apply it now at a much broader scale, IoT is in big, broad ecosystem, consumer devices, other systems, real-time location services. We talked about how sometimes folks get that mixed up. The way I think about it is now instead of a patient, I have a health system where I'm trying to create that digital representation through real-time and predictive data. So people have data in real time. We can create predictions that help them see what's coming and then actually action it. And then also take that data and put it inside of workflows. We don't want the swivel chair anymore. So yes, a bed manager may work in a bed management system. That's part of the ecosystem, right? It's a resource we need to take care of patients, a space to care. But I don't want our clinicians, our end users, having to leave their workflow in an EMR to go find out what's happening in their patient throughput journey. So that's the way we kind of think about real-time health system. It's an entire ecosystem, a digital representation of how the health system is operating at any one time.
At Oracle Health Summit, I had the chance to speak to a few of Oracle's partners about the event itself and about the types of challenges they are speaking to their customers about. Here's a few of those conversations.
Good afternoon. My name is Brittany Potter. I am from IMO Health. I'm a senior client executive for the Tennessee area. And we are here at the Oracle Health Summit this year, speaking to our clinical diagnosis terminology, our problem list management solutions, SurgiNet, surgical scheduling mapping, so CPT, but also in your native functionality within Oracle Health for ICD-10 and SNOMED for all of your visit diagnoses. I'm very excited to be here this year and appreciate the invite. Thank you.
My name is Jeff Barlow. I work on the client sales team at Kairos Health. We partner with Oracle to integrate our care access platform into their EHR to help patients schedule and find the appropriate doctor for the care that they're seeking. So we've had a long-standing partner with Oracle, and we're really happy to be here to help sponsor the event and interact with some of our customers that also have long-standing partnerships with the company. So really happy to be here and spend this time with Oracle.
My name's Charlie Donahue. I'm a sales director on the healthcare team here at Flywire. We're having a really great time at the Oracle Health Conference right now, really attacking some of the pain points that come for our Oracle partners within the revenue cycle space. One of the biggest pain points is really around affordability for patients. And so what we're having a good time discussing today is tailoring the different options that we can provide to patients, which ultimately kind of fulfills the full continuity of care for patients or patient experience. Clinical outcomes are obviously the priority when it comes to healthcare, but rounding it out with a enjoyable payment experience as well really circulates that experience patients have with our Oracle Health clients. So it's been great talking to partners and just diving into some of the pain points and how Flywire can really ultimately solve some of those problems.
My key takeaway from this event is the investment that Oracle has made in its new EHR. It is clear that tens of thousands of hours have gone into writing new code, designing new interfaces, and the new system leverages all of Oracle's strengths. I believe it is the first EHR that is AI native. Now, it's too early to tell if this new next generation EHR will be a hit with customers, but it has already overcome one very big barrier, and that is getting the Oracle Health team excited. Every Oracle Health person that I connected with here at the summit is energized and excited, not in a fake smile and nod kind of way. It is genuine excitement, kind of like what you would feel before the start of a race. Honestly, I think this was job one for Oracle Health. They needed a win, and this new EHR, plus all the other investments they have made, seem to be exactly what the doctor ordered. It'll be interesting to see and track how this next generation EHR is being perceived by customers and what the feedback will be over the next few months when it starts rolling out in 2025. Hey, if you enjoyed this piece, please mash that like button and click subscribe. Also, head on over to healthcareitttoday.com where you will find more great content like this. I'm Colin Hung here in Nashville, Tennessee at the Oracle Health Summit. Thanks for being here, and I'll catch you on the next video.